Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with some of the important MCQs. Who all have visited first time on this channel, please do subscribe. We'll see the first question. Which chromosome abnormality causes Down syndrome? Here, options are given. Trisomy 21. We'll move to the next one. Turner syndrome occurs due to absent X chromosome in females. Next question. Klinefelter syndrome is characterized by male with 47 XXY karyotype. Next question. Which is the main cause of chromosome abnormalities? That is errors during meiosis, that is causing non-disjunction. Next question. What is monosomy? Loss of one chromosome from a pair. Next question. Which of the following is a structural chromosome abnormality? Inversion. Next question. A nurse is caring for a child with Down syndrome. What is an important nursing consideration? Right option is A, that is monitor for respiratory infections. Next question. Which prenatal test can detect chromosome abnormalities? Right option is B, that is amniocentesis. Next question. Which chromosomal abnormality in Turner syndrome usually results in? Options are given. Right option is B, that is immature sexual development. Next question. What is the common physical features of Klinefelter syndrome? Right option is A, that is small testes. Which of the following is an example of an autosomal trisomy? Options are here. Down syndrome. Next question. In non-disjunction chromosomes fall to. Options are here. Segregate properly during meiosis. Next question. Which syndrome caused by trisomy 18? Right option is A, that is Edwards syndrome. Next question. Which is a typical developmental concern in children with chromosome abnormalities? Right option is delayed motor skills. Next question. Which chromosome abnormality can be compatible with survival into adulthood? Trisomy 21. Next question. The nurse should provide genetic counseling to families with history of chromosomal abnormalities. Next question. A nurse explains to parents that Klinefelter syndrome affects males only. Next question. Which syndrome is not commonly seen in Turner's syndrome? Excess body hair. Next question. What is the significance of a balanced translocation? Right option is individual may be normal but with abnormal offspring. The most common sex chromosome abnormality is Klinefelter syndrome. Which chromosome abnormality is related to a characteristic cry resembling a cat's meow? Cry-do-chat syndrome. Which test provides a visual picture of chromosomes? Karyotyping. Which nursing intervention is essential for a child with chromosomal abnormality? Promote developmental stimulation. Which chromosomal abnormality is associated with female infertility and lack of secondary sexual characteristics? Turner syndrome. Nurses caring for newborn with chromosomal abnormality should focus on supportive care and family education. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.